And GPs are also under the pump. Preventative and routine care are being put on the back burner while they're overwhelmed with patients who have COVID, the flu and other winter bugs.
Health New Zealand says it's closely monitoring whether winter illness is impacting on doctors' ability to screen for cancers. Ashley Yates has more.
The perfect storm of winter illnesses is making it much more difficult for GPs to deliver routine and preventative care.
Routine care for things such as diabetes, heart disease, cancer in the community, preventative care for things like cervical screening and immunisation, especially on our young tamariki.
All examples of standard care GPs deliver, but as winter hits,
they're just getting squeezed out at the moment due to capacity.
Dr Brian Betty says the winter demand has exacerbated backlogs caused by COVID-19, like the one for cervical screening.
I think it's very concerning that we're going to have to put a large amount of effort into catching up on these very, very important aspects of general practice and medical care in the community. So that will take time, it'll take effort, it'll take resource.
According to Health New Zealand, as of the 31st of December last year, approximately 34,000 cervical screens are needed nationally to reach pre-COVID-19 coverage levels.
By the end of March 2022, we were actually down to 55% screening against a target of 70 for Māori, Pacifica and some other groups. So actually now something off the back of that, meaning that that rate may be dropping even lower, is a real concern.
Vaccine expert Helen Patoussis-Harris says she's concerned children may not be getting their vaccines due to GP capacity.
We're already coming into this at a place of disadvantage where our rates were already declining, so this has just made it a lot worse.
She says child vaccine uptake's been eroding since 2016. Now with COVID, it's just compounded.
At the moment, we're looking at about 1 in 3 Māori kids being at risk of measles, susceptible to measles. And we've lost a good 10 percentage points off our overall coverage at critical times.
We need to use things like telehealth and new modalities of doing things. We need to use triaging and things like Healthline to manage acute demand. We need to keep immunisation rates high to try and lessen the burden. And going forward, over the next year and the year after, we need to ensure that this type of problem doesn't arise again.
It's a problem that will linger through winter, but one that can be eased if people not only get themselves, but their kids vaccinated too. Ashley Yates, Newshub.